talk an awful lot on this program about medical technology, but our next guest can tell you about a procedure that will probably surprise you with its sophistication and gee whiz promise all at the same time. Joining us now, Dr. Mike Malek, an orthopedic surgeon in private practice. And our topic this time is something called Autologous Chondrocyte Implantation, ACI for short. Nice to have you here, Doctor.
Nice to be here.
ACI literally means you go in ahead of time, you take some tissue from inside the knee, take it outside into the laboratory. You don't clone, do you, or is it a cloning technique?
No, actually what happens, it would be a cartilage biopsy. A small portion of the cartilage from normal part of the knee, which is not essential or it's not vital to the structure and function of the knee, would be biopsied, and it would be transported to the Genzyme facility in Boston. They are the only facility at this point they are doing this procedure, and they would basically culture this and repopulate this, and they are telling us by the time they are finished in about 3 to 4 weeks, we would receive back about 12 to 15 million cartilage cells or chondrocytes in the form of liquid. Then we have to go back and do the actual surgery, which is opening the knee up and finding the area of damage and basically patch the area with this form of cartilage which has been grown.
For a lot of people, this notion of using the body to grow its replacement or repair parts is kind of the very frontier. But you're actually doing this right now. This has been a procedure that's been used in Europe for a considerable period of time.
Yes, this actually started in the basic science of that actually started in New York initially in early 80s, and then it was taken back to Sweden. In Gothenburg, Sweden, at the University of Gothenburg, the basic science was completed. The procedure then was developed, and they have been doing this since 1987. FDA approved this in the United States for usage in the lesions of the femur or the thigh bone in September 1997.
It is one thing to think about it as sort of a remarkable achievement, but it's another thing to think about it as an actual useful medical tool. For whom does this hold the most promise? Who benefits from this?
The procedure generally is done for large lesions, which we cannot deal with it and with other techniques. There are other techniques available dealing with a small cartilage lesion, but this is a large lesion, generally over 2 centimeters in diameter and deep in the weight-bearing area of the femur or thigh bone. It has to be someone probably between the ages of 15 and 55. There should not be any associated arthritis in the joint, and there should not be any angular deformity. That's the proper candidate for this procedure.
We talk about lesions. Are these arthritis-caused problems? Are these sports injuries? How does the lesion get there in the first place?
Most of these lesions are traumatic events, either sports or automobile accident or work mishaps, police officers, firefighters, and so forth. So this procedure is not suitable for people that they have large areas of arthritic conditions.
You talked about this having 12 or 13 years worth of clinical experience here. What's the success rate? Is this a very good alternative?
The recent study, which was presented at our national meeting a year ago, indicates 84% of good or successful or excellent result outcome after 2 years of procedure.
And is it likely that that continues to last, I guess?
Well, the interesting thing is that the Swedish people, they presented their long-term result of 5 to 10 years, and the number of almost the same, almost 84 to 86% satisfactory outcome.
Now, anytime we use that word autologous here, we're talking about using the body's own, and that overcomes a considerable number of problems here. You're not talking about transplantation of someone else's cartilage. This is the body's own.
That's correct. It's individual's own tissue, which has grown under laboratory condition, and there would be no issue with rejection. There would be no really complication related to taking one piece from one part and placing in another part. It just comes from that same knee joint and goes back to that same knee joint.
Dr. Mike Malek, thank you. Fascinating stuff. This really is the cutting edge when we talk about medical technology out there, and appreciate your sharing it with us.
My pleasure.
We hope you'll join us next time here on Healthline. Health information literally at your fingertips. We're going to find out about a printed resource to help you find the area's top doctors. Also, a website that gives you one-on-one attention from a doctor whenever you need some personalized advice. That's all of our time, though. Thank you very much for your time. I'm Dave Lucas, reporting on the Healthline.
There is encouraging news tonight about a treatment that's helping people with injured knees.
Eyewitness Health reporter Beverly Burke joins us with details. Beverly.
You probably know someone who's badly hurt their knee and they are in pain. And sometimes this is very debilitating. Every year, 5 million people see an orthopedic surgeon for knee problems. And now doctors in our area are offering a breakthrough procedure that treats damaged knee cartilage.
At first, I just felt a real bad burning pain.
Michael Bibb is no stranger to knee problems. His first injury was in his right knee in 1990.
And you always hear the horror stories. You know, once you have a knee injury, you're going to have problems.
In 1995, Michael was one of the first people in the country to have a revolutionary procedure. It's called Autologous Chondrocyte Implantation, or ACI. It worked so well for him, last month he had it done on his left knee.
This procedure gives the patient the opportunity to form their own cartilage, and basically cartilage which is durable, which is strong, and it lasts longer and it functions better.
Nice, please.
Choosing only an epidural, Michael was awake during the surgery.
Table down, please.
ACI takes place in several stages. Doctors collect healthy cartilage tissue from the patient during arthroscopic surgery. The collected tissue is sent to a lab in Cambridge, Massachusetts, where the tissue is cultured. In 3 to 4 weeks, millions of new cells are grown. Then they're sent back. Doctors perform a second procedure to remove the damaged cartilage. A skin-like graft from the patient's own leg bone is sutured over the damaged area to provide a protective cover. Then the cultured cells are injected under that flap. Here they continue to multiply and repair the knee.
And this was a very large lesion, so we are putting a double dose of approximately 24 million cartilage cells.
Once damaged, cartilage doesn't regenerate in the body, but with ACI, the patient's body accepts its own cells.
Prior to this procedure, a good percentage of our population of damaged cartilages would have ended up having degenerative arthritis at the later years. When they were getting to their 50s and 60s, those patients would have ended up with a knee replacement.
Michael, how does it feel?
Just hurts a little bit.
Just 2 days after surgery, Michael is on his way to having 2 healthy knees again.
It looks very nice and clean. You don't have much of a bleeding.
Eventually, Michael will work out on equipment like this to strengthen his knee. This procedure and treatment expensive, about $30,000. But more and more HMOs are willing to pay it because they realize that this operation helps eliminate the need for future surgeries as the patient's body ages.
This is it's going to be very thin layer here. So
Michael knows full recovery from ACI takes about 2 years. He admits the physical therapy is tough.
It's like taking a rubber band that's 5 inches long and cutting it down to 2 inches and then restretching it.
But he's got high hopes.
After seeing how far I've come with the right knee, I mean, I have no pain. I hope that I can put my life back together and get back to doing what I was doing before I got hurt.
Cell harvesting and regrowth was approved by the FDA 2.5 years ago. So far, studies show an 85% success rate for patients in the U.S. and has been available in Europe for more than 10 years, where doctors there have reported the same success rate. Right now, of the 25,000 orthopedic surgeons in the U.S., less than 500 are trained to do this procedure.
Wow. Is this what Mike Flynn, our photographer,
Yes,
here
that's what
and he's back out
He's
there.
looking pretty good.
Absolutely. Our LASIK patient, she's doing well?
She drove to the doctor's office for a follow-up. She's doing great.
That's great.
She's wonderful.
That's from last night's 11.